Hello everyone, and welcome to our virtual educational program. In this video, we will be discussing mirror therapy. Mirror therapy is a unique rehabilitation technique that can help individuals improve mobility in the hand and arms, and sometimes in the legs. Mirror therapy was first introduced to relieve phantom limb pain among individuals who experienced pain in their amputated limb. However, since then, it has been used by individuals with a variety of conditions, including stroke and brain injuries. In mirror therapy, a mirror is used to create a reflective illusion of an affected limb in order to trick the brain into thinking movement has occurred without pain, or to create a positive visual feedback of the limb movement. It involves placing the affected limb behind a mirror, such that the reflection of the opposing limb appears in the place of the hidden and affected one. Then, the individual uses the non-affected arm to perform various arm and hand exercises while watching the reflection in the mirror. This helps trick the brain into thinking that you are moving your affected arm, even though you are not. There are two main hypotheses that support the validity and benefits of mirror therapy. One of the main reasons that mirror therapy is thought to work is due to mirror neurons. These are nerve cells that are activated by performing a movement or by simply watching a movement occur. Through engagement in mirror therapy, these neurons are activated, and as a result, the brain gets the feedback necessary to spark the processes of motor learning and neuroplasticity. Neuroplasticity has been described as the science of how the brain changes its structure and function in response to input. In the case for mirror therapy, neuroplasticity strengthens existing neural pathways and creates new ones through stimulation from the mirror neurons. For more information on neuroplasticity, please visit our website for a video on this topic. The other hypothesis that supports mirror therapy is that this rehabilitation technique increases self-awareness and spatial attention by activation of specific areas in the brain, such as the primary and secondary visual and somatosensory areas. As such, mirror therapy is thought to enhance attention, conscious awareness of sensory feedback, and avoidance of learned non-use of the affected limb. Among the benefits of mirror therapy are improvement in hand and arm paralysis, increase in leg mobility, decrease in post-stroke pain, improvement in hemineglect, improvements in sensation deficits, and the fact that this is a low-risk, cost-efficient treatment. In fact, this therapy can be done with your therapist in a clinical setting, as well as in your home on your own. So, let's talk about how you can practice mirror therapy at home. Before beginning this therapy, keep in mind that, to participate, an individual should have enough postural control to sit independently in a chair or wheelchair. The individual should also have enough functional vision to be able to see the reflection in the mirror. And the unaffected arm should have enough pain-free range of motion in order to engage in the therapeutic exercises. In the following slides, we will talk about the steps you can follow to perform mirror therapy. Place a tabletop mirror over the affected hand and arm, with the other arm resting on the table next to the mirror. Although any mirror will work, it is important that your affected limb is not visible, as to create the illusion of movement through the reflection in the mirror. You may purchase a mirror with this function online. The picture here presented is an example of a mirror box you can purchase on Amazon. Spend a few minutes observing the reflection and getting used to the optical illusion. It can be helpful to think of the mirror as a window instead of a reflection. Begin by practicing simple hand exercises with the non-affected hand. For a helpful guide on hand exercises, please scan the QR code on this page, which will direct you to a website with 39 hand-strengthening exercises you may practice as part of mirror therapy. And finally, complete these mirror exercises for at least 10 minutes, working your way up to half-hour sessions. And make sure to keep your eyes on the mirror the entire time. It is important to be repetitive with the exercises, as practicing the same, specific hand and arm exercises will help activate neuroplasticity. Additionally, Mirror therapy should be incorporated into daily exercise, as most benefits are seen with consistent engagement in this therapy. Does mirror therapy have any side effects? As the individuals who engage in mirror therapy are often individuals with a stroke, some of them may react emotionally to the thought of seeing their affected arm intact. Be prepared for these reactions and approach your loved one with patience and understanding. Additionally, some patients may also experience dizziness or nausea when viewing the reflection. If this occurs, ask the individual to look away and focus on the unaffected arm until the unpleasant sensation dissipates. For those individuals who have the ability to move their affected arm and hand, however, are weak and uncoordinated with the movements, it may be interesting to look into the Flint Rehab Music Glove hand therapy device. This is an FDA-approved device that helps improve mobility in the hands and fingers by combining music with therapy. It may be a motivating and engaging rehabilitation device for individuals who have limited mobility in their hands and enjoy music. For more information, please visit the Flint Rehab website. In conclusion, mirror therapy may be an effective non-pharmaceutical, cost-effective treatment technique for individuals with a stroke or brain injury. Thank you for your attention during this presentation. We hope the information provided was helpful to you.